Welcome to the Airborne Infectious Disease Exposure Prevention Plan training. I'm Heather Zabrowski, Chief Human Resource and Diversity and Inclusion Officer for Security Mutual. This training is being provided as a supplement to previous communications regarding Security Mutual's response to the COVID-19 pandemic and provides additional details regarding current safety protocols and controls. For Security Mutual, the health and safety of our employees, tenants, visitors, and community are a priority, and during the extraordinary challenges of the COVID-19 pandemic are a major focus. In addition to the policies and guidelines we review in this training, we encourage employees to continue to be aware of and follow health and safety measures at home and in the community as we all work together for everyone's safety. This training summarizes our current protocols and provides important reminders that we all must adhere to while working. As always, if you have any questions, please do not hesitate to contact Human Resources or me directly as the company's Pandemic Safety Officer. Let's begin with understanding what COVID-19 is. According to the CDC, COVID-19 is a respiratory disease caused by SARS-CoV-2, a new coronavirus discovered in 2019. The virus is thought to spread mainly from person to person through respiratory droplets produced when an infected person coughs, sneezes, or talks. Some people who are infected may not have symptoms. For people who have symptoms, illness can range from mild to severe. Adults 65 years and older and people of any age with underlying medical conditions are at higher risk for severe illness. People 12 years and older should get COVID-19 vaccines to prevent getting and spreading the illness. The symptoms of COVID-19 can include the following: cough, shortness of breath or difficulty breathing, fever or chills, sore throat or runny nose, muscle or body aches, nausea, vomiting or diarrhea, new loss of taste or smell. It is important that you know the symptoms of COVID-19, are aware of how COVID-19 can be transmitted, and are following the steps necessary to prevent the spread. COVID-19 spreads when an infected person breathes out droplets and very small particles that contain the virus. These droplets and particles can be breathed in by other people or land on their eyes, nose, or mouth. In some circumstances, they may contaminate surfaces they touch. People who are closer than 6 feet from the infected person are most likely to get infected. COVID-19 is spread in 3 main ways: breathing in air when close to an infected person who is exhaling small droplets and particles that contain the virus, having these small droplets and particles that contain virus land on the eyes, nose, or mouth, especially through splashes and sprays like a cough or sneeze, or touching your eyes, nose, or mouth with hands that have the virus on them. Security Mutual has adopted the New York State Airborne Infectious Disease Exposure Prevention Plan, which is published in the Employee Safety Manual and communicated to employees on September 3, 2021. The Employee Safety Manual can be accessed through Librarian and on ADP. The purpose of this plan is to protect employees against exposure and disease during an airborne infectious disease outbreak. This plan goes into effect when an airborne infectious disease is designated by the New York State Commissioner of Health as a highly contagious communicable disease that presents a serious risk or harm to the public health. This plan is subject to any additional or greater requirements arising from a declaration of a state of emergency due to an airborne infectious disease, as well as any applicable federal standards. Employees should report any questions or concerns with the implementation of this plan to one of the designated contacts shown in the plan. As part of this plan, any employee entering the building must go through a brief personal health screening. Those employees must complete a daily entry questionnaire with current health screening questions. Please be sure to read the daily questions closely each day as they may change due to changing conditions. The Employee Daily Entry Questionnaire is available by link through QR code or on the homepage of ADP portal. Simply click on the link, log in using your network user ID and password, provide dual-factor authentication, answer the questions, and click Submit. If you do not have a mobile device or computer access, paper questionnaires will be available for you at the guard desk and must be completed each day prior to working. If you answer yes to any of the entry questions, you are not permitted to enter the building. Another part of the daily health screening is to have your temperature checked at one of the temperature check kiosks each time you enter the building. For those employees who work in the home office, you must enter the building through the back entrance at the start of your shift. If you leave during the day, for example at lunchtime, you may re-enter the building using the main entrance and the kiosks in the front lobby. The kiosks are set to permit entrance into the building if your temperature is below 100.4. If your temperature registers above 100.4, the kiosk will send a notification to Human Resources and notify you to proceed to the waiting area behind the guard desk in the front lobby. There, you may sit and rest for up to 15 minutes before having your temperature rechecked at the kiosk. If your temperature again registers above 100.4, you will not be permitted to enter the building and must return home. As you know, we have implemented many protocols to help protect our employees under these COVID-19 circumstances. We continually update and enhance these protocols and want to remind you of the protocols currently in place. Personal protective equipment. While in the building, all visitors, tenants, and employees must wear face coverings in all common areas of the building. Common areas include, for example, the lobby and entryway, hallways, stairways, elevators, restrooms, cafeteria, atrium, and conference rooms. Employees may wear face coverings at all times in the building, but are not required to wear face coverings at their workstations unless they are unable to maintain a distance of 6 feet between themselves and any other person. Physical distancing. In the current environment, physical distancing must be maintained both in the office as well as in public places. A minimum of 6 feet distance between individuals is the goal. Therefore, you'll notice, where possible, we have staggered workstations to help support a minimum of 6 feet of separation between employees. Plexiglass shields are also installed for certain work areas where cubicle walls and distancing are not optimal. We provided social distancing reminders with distancing markers and directionals around the workstations and building common areas. We have posted occupancy limits for certain common areas, including elevators, restrooms, and conference rooms. We all must carefully adhere to these occupancy limits to support physical distancing measures. In order to reduce in-person meetings, we will continue to use technology such as Jabber, WebEx, and soft phone devices to support our employees working in the office as well as those working remotely. Unless absolutely necessary, meetings are to be held remotely. This includes travel and business meetings. Non-essential business travel remains suspended until further notice. Any essential business travel must be approved by the department's senior management, and while traveling, all social distancing and face covering protocols must be carefully followed. Even if travel is necessary, it could lead to quarantine requirements upon the employee's return. Lastly, seating in common areas has been reduced or removed to deter social gatherings and limit the need for cleaning. The cafeteria will continue to operate on a grab-and-go basis and is currently closed to visitors and the public. Notification of a perceived violation of this plan or an infectious airborne disease exposure concern may be made by an employee either verbally or in writing and could be communicated via electronic means. Employees exercising their rights under this plan, including reporting perceived violations or concerns to their employer, state and federal government agencies or officials, will not be threatened, discriminated, or retaliated against. Thank you for taking the Airborne Infectious Disease Exposure Prevention Training and your commitment to the health and safety of our workforce and community. As a reminder, the current version of the Employee Safety Manual is located on Librarian and the ADP portal and includes additional information on the Airborne Infectious Disease Exposure Prevention Plan. If you have any questions regarding the plan or protocols covered in the training, please do not hesitate to contact Human Resources.